Welcome to Mom in Mind. I am your host, Dr. Kat. For the month of October, we are covering stories from people who have lived experience of dealing with pregnancy or infant loss. As usual, when we go over episodes that tend to be a little bit more difficult in terms of the content, I welcome you to decide for yourself if listening to this week's episode is available and up for you. And if it's not, then this episode will be available whenever you're ready. This week, we are talking with Jen Burgard. She is the mom of 2 living children and one who lives solely in her heart. She is a lost mom, a living mom, wife, founder, podcaster, director, and most proudly, survivor. Upon the death of her second child, she set out to fill a gap in accessibility to resources, support, and community for others who are also experiencing trauma. With a personal experience of her own and her newly formed network, she launched Haven as a service to grieving parents in and around her region. Today, Haven has touched each of the 50 states with their healing gifts, podcast content, and online grief workshops. With a goal to bring awareness and understanding not only to child loss, but our grief culture in general, she is creating and building conversations through her podcast called Landscape of Loss. Today, Jen is sharing with us parts of her personal story and what prompted her to start this program. And we go over various ways that trauma and PTSD can show up for people as a result of pregnancy loss, and how that can look different from person to person. As you've maybe heard before, the saying trauma is in the eye of the beholder. That really means that your own personal experience, whether other people agree with it or not, can be traumatizing even if no one else sees it or understands why. And as you probably heard about on the podcast already, and as I'd like to reinforce, pregnancy loss is often called a traumatic type of loss. And through the program that Jen has started, she is really aiming to help and support pregnancy loss families, infant loss families, so that they know that they're not alone. On that note, let's hear from Jen. Welcome, Jen. Thank you so much for being with us.
Thank you so much for having me. I'm happy to be here.
Yeah, I'm especially grateful that you're sharing your story and we'll be able to share this during Pregnancy Infant Loss Awareness Month. As part, I'm sure, as you know, through your work and your podcasts, that more and more people are learning about the depth of this kind of loss and the sensitivity that comes with it. Sensitivity meaning you've been feeling this loss for a long time. And if not, yeah, we'll get into that. But it's just especially important during this month when awareness is being raised to have stories like yours being shared. So, yeah, I'd love for you to start wherever you're comfortable.
Great. Well, thank you. And thanks for hosting this space, especially in light of pregnancy and infant loss remembrance. It's such an important topic and truly one I didn't really have any kind of idea or grasp on. Like you don't really. I mean, we all know about Breast Cancer Awareness Month, right, in
Mm.
October as well, which is incredibly amazing cause. And this is one it wasn't on the radar for me. And so in 2016, I was pregnant with my second child, a little boy, a little brother to his big sister, who was 2 at the time, just about 3. So I had my perfect little nuclear family, all keyed up, ready to go. And um, no issues in the pregnancy. And then at 39 weeks to the day, I was making breakfast for my daughter. And um, I had just this strangest feeling. And I sat down to just rest because, you're tired.
Mm.
39 weeks. Um, just sat down to rest and immediately felt better. But then a couple seconds passed and I looked to my husband and I said, "Oh my gosh, I think my water just broke." And I was so excited. I was like, "Oh, this is great. This is great. I just went into labor naturally on my own. This is what I've always wanted." It's fantastic. It wasn't until I quickly got up and went to the bathroom that I realized that it wasn't my water that broke and that I had lost an incredible amount of blood.
Mm.
I passed out from lack of blood, I believe, and maybe shock. But when I woke up, my husband was there and my daughter was there, and they were calling the hospital just to kind of get an understanding of what was going on, what we should do. Um, so we rushed in immediately, and we got there, and after some check-in processes, the doctor did decide to take me for an emergency C-section. He said he saw a flicker of a heartbeat, and so we went, and within 8 minutes from that decision, my son was born, and I was not awake for any of it. I was put I was put out under anesthesia, and when I woke up, I remember being mostly alone. There was a nurse in the room, but it was in a strange room. It felt like a closet, which it was odd. And I
Mm.
remember thinking I was in a dream, and so I asked the nurse if I could see my husband, and she obliged quickly. And when he came in, he just took my hand and he said, um, we're not going to get to take him home. And I didn't know what he meant necessarily at that time. I was really hopeful that that meant there was hope, right? There was a chance, or, I just wasn't sure.
Right.
Well, came to it, and what had happened is excuse me. What had happened is I'd experienced a complete placental abruption
Mm.
at exactly 39 weeks.
Mm.
And, our son just didn't have access to oxygen for a fair amount of time because it happened at home, right? And,
Mm.
um, they did the C-section, they did everything as quickly as possible. They actually successfully resuscitated him, and then said, he has as long as, he's willing to fight and he's willing to give you, but really he's not going to make it. He's just every test, every effort, he's not going to make it.
Mm.
So we knew um that he was going to die there that day. We didn't know when, we didn't know what it would look like, what it would be like, but so we had just under 13 hours with him. So 13 hours to let some of our family meet him, to, just take in every moment that we possibly could and hold him, kiss him, love on him. And then eventually, about 10 o'clock that evening, he took his last breath within our arms, and that was it. And, you know, it's when I tell this story, sometimes I think it sounds so gentle and soft, and, but I think that's so different from the way that we were feeling
Mm.
internally about it. I think there's a lot
Right.
of great care in that space, right? The nurses, the physicians that are there. There's so much great tender care, but inside, I mean, it's turmoil, right?
Right. Right.
I
Absolutely.
mean,
Yeah, that's my
uh
my wonder, like how are you actually doing?
yeah, so the weeks that followed, the days, the weeks, the months, it was rough, right? It was rough, and it was all very, well, whatever you're feeling is okay. It's normal. You're going to go through these phases of grief, but you'll be in and out of those, and then eventually you'll be better, and you'll be fine.
Mm.
Right? And that was that was just felt like such
Mm.
misguided advice, because I think in my mind I was confused. In my mind I was very confused because I'm looking at it like this is the 21st century, right? How is this happening exactly?
Mm-hmm.
And they even in the hospital they would say this never happens. This never happens.
They said that?
Hmm.
Oh,
Said we are so sorry. This never happens.
no, don't say that either.
I was like, well, why me though?
Right.
Why did it happen to me? What did I do? So I immediately started to blame myself.
Of course.
And I remember thinking, well, there must be a reason, right? Because that was another thing that people used to say, well, there's always a reason for everything that happens. And I took that the reason was I was being punished.
Mm.
I was being punished for some mistake or something I'd done at somewhere in my life, and I couldn't figure out what it was, but I must have done something horrible to deserve this. So I'm racking my mind trying to think of all the reasons that this is my fault.
Right.
right? And this is my penance, right? And um at the time, I wish I would have had uh, someone to kind of speak these words to out loud at that time. I
Right.
should have been journaling, and kind of writing these things down because I think it'd be amazing to go back, and look at that 5 years later and say,
Mhm.
wow, that's what a different mindset, because I think you would gain so much clarity from that.
Yeah, I am. I mean, I am thinking for, mm, right, it's similar to how you were saying, like it looked so peaceful on the outside, but there was the turmoil happening inside. If I can, for a moment, just go back to
Hmm.
um, you finding out that your son was going to pass. Like, what happens in that moment?
I felt like they said, when they came in, the NICU, physician came in and said, this is what we did. These are the tests that we've done. This is all the stuff, right? Like we've tried this and this and this, and this is the results. And, in the end, this is your decision, right? Whether to, for lack of a better phrase, pull the cord, that this is the outcome. It's the same, and I, as if my blood hadn't already literally drained from my body, I felt like it's like I felt everything
Mm-hmm.
drop out, right? And then,
Mm-hmm.
the actual physical, I know physically my heart did not sink, but it felt like physically things shifted. It felt like,
Mm-hmm.
and I can only assume that it's nerve endings, right? That are firing, and that are in response to what your brain is feeling, or what you're feeling, and what your brain is processing. But I felt it. I felt it when they said it. And I was stuck between wanting to cry and tears streaming down my face, and wanting to stay strong, right? And be that person that, well, she handled it real well, right? She really toughed that one out. She's so strong, and I wanted to be that strong person,
Mm-hmm.
not for me, right? I
Mm-hmm.
didn't want to, it wasn't for me, but I just wanted, I didn't want to cause problems, right? I wanted to be a good patient. I wanted to be a good mom, a good wife, a
Mm-hmm.
good daughter, right? I wanted to do all the right things, make sure everyone else got to hold my baby, and that I was, again, not causing any problems, right? And so on the outside, that's how, like, that vision, right, that I was trying to create, but on the inside I was screaming.
Mm-hmm.
I wanted to throw things,
Of
right?
course,
I
yeah.
I wanted to, scream at every person who walked in the room. I wanted everything to stop. I wanted them to shut
Right,
the lights off. I wanted traffic to stop. I
right.
was angry at traffic,
Of
like
course, yeah.
happening outside,
Mm-hmm.
because
Mm-hmm.
my world stopped. Mine stopped, and it felt like everything else just kept going.
Mm-hmm.
And it felt so unnatural.
That everything else is just continuing to go.
Right.
Yeah,
Right.
yeah.
I mean, I just kept thinking, well, if they knew this is what was happening right now, everything would stop.
Mm-hmm.
Everything would stop.
Mm-hmm.
I mean, we are the centers of our own universe, right? So, but and that's how I felt in that moment, right? I mean,
Mm-hmm.
in the hospital, those first few days, it was, I got to imagine, just some shock,
Right. Like a numb feeling, or just like feeling everything, kind of a, or both.
I would say more numb. I would say
Mm-hmm.
more numb, because I
Mm-hmm.
don't think the reality set in until, you know, um, days later. Of
Mm-hmm.
course, you go home, but we were so lucky to have family and friends around that were
Yeah.
incredibly supportive, right? But they start to go home, right? They leave, and they need to get back to doing what they're doing, and then it's just you, right? And you're there, and you're supposed to be parenting, and you're not, and then it really sets in. And I think when my husband went back to work,
Mm-hmm.
I remember one morning actually feeling the feelings, and it was like, this is it. this is the bottom, right? Like
Mm-hmm.
this is the moment. And so I just remember thinking, yeah, this is it. And I will never forget, I laid down on the floor in front of my fireplace where I had his photo, and I just cried and I screamed and I was angry and I was finally let all of those feelings out that I was feeling, and it was not attractive. I mean,
Mm-hmm.
it's
No,
not a good look, right?
it's
But
real
I
though.
just it was real, and I scared myself. I
Mm-hmm.
scared myself with this reaction because I had never felt this way. I had never endured anything like this in my life. And, I'm so grateful. I think I do when people say things happen, right? Or for a reason, or however you want to address that. Randomly, my husband called me from work that day, and this wasn't his first day back. He doesn't call me from work. He's busy. And he called me right in this moment and just said, "Hey, I just wanted to check in on you. I just had this feeling and I wanted to check in on you." And I'm just like, and it was the one thing that pulled me up off the floor.
Mm-hmm.
And it pulled me up off the floor and got me to keep going.
Right.
Even just throughout that day for that hour, right? I made it through another hour
Mm-hmm.
because of that one phone call, that one thing that helped, right? You need to see the light again,
Yeah.
when you're just so dark and you're in that place. And so
Right, and it's like all consuming internally. Like there's nothing else happening.
there was nothing else happening.
Mm-hmm.
Nothing else happening. And I haven't been in that spot again since. And so I do consider it in some ways rock bottom, but then it turns out there's different there's different versions of that,
Mm.
right? I mean, I can almost giggle about it now, but really the last 5 years have just been sprinkled and littered with different moments and different experiences that really, I mean, I don't know which one is, I wouldn't say one is worse or better, or it's just different, you
Mm-hmm.
know? It's
Right.
just different.
Right. So that I mean, this is what you're talking about. Your experience is like very very close to the time that he passed, and you're postpartum,
Mhm.
and still I'm having to physically recover, let alone mentally, emotionally to cope and deal with all that has happened. So outside of that immediate intensity, what would you say about, mm, for lack of a better word, like recovery and healing? What's that process, and how long does, again in air quotes, like how long does that take?
Yeah. Well, we know that's a lifelong process, right? So
Mm-hmm.
that's an easy answer, right?
Right.
How long
Yep.
does it take? Grief lasts as long as love lasts, right?
Yep.
And so um I think, you could start to identify moments that were pivotal and change. I think at some point I had to go back to work, right? And so about 4 months after I went back to work and, you know, dipped my toe in that water, started out part-time, which I think I would recommend to anyone if you
Yeah.
can make that happen,
Right.
and I had conversations, very direct conversations with my superiors at my office and just said, look, like, this is what I need.
Mm-hmm.
I'm gonna need some space, but I need you to not be afraid to talk to me for number one.
Mm-hmm.
For number two, sometimes I'm gonna need to just go in this conference room and cry.
Right.
I
Yeah.
don't need you to check on me. I'll be okay.
Right.
But I might just start crying, and that's okay. And no one has to be afraid of me or
Mm-hmm.
afraid of that, right?
Right.
And so, and the third thing is, partially with, don't be afraid to bring it up. Don't be afraid to bring up my son because I might cry. I probably will. If you
Right.
bring him up, I
Right.
will. But it's not because you brought him up. Because I'm always on the edge of tears at this
Mm-hmm.
stage, right? I'm
Yeah.
always about to cry. So it could happen regardless of anything you say or don't say.
Right.
Um, and so this really was my first bit in practicing how I was going to be and function in public as an adult human woman that has a job and another child at home and friends and
Mm-hmm.
colleagues, right? I still have to be that person if I want, right? Or some version of that person, and so it was practice. It just took practice.
Mm-hmm.
And slowly I built up this, you know, almost an armor or a muscle, right? That helped protect me and
Mm-hmm.
help protect, my heart for those moments we know that there are people because we know that there are people that just maybe aren't going to get it or don't want to
Right.
talk about it. And that's okay.
Mm-hmm.
But I have to be able to protect myself from that situation so I don't let it pull me down
Mm-hmm.
and pull me into a place that I've already grown from, right?
Mm-hmm. Mm-hmm.
And so I don't need their understanding, approval, acceptance about the way that I'm grieving or the way that I'm feeling
Mm-hmm.
in order to feel whole, right? In order to feel like I'm growing and I'm filling my heart back up, right?
Mm-hmm.
So
Mm-hmm.
I think one of the hardest things though was a lot of um, behaviors that changed for me and onset of new behaviors that were confusing, and at the time I really didn't get it. And specifically, I remember I went for a walk with a friend, and she had come to visit me, and I said, let's go for a walk so I can clear my head. A slow walk because I'm recovering from a C-section, right? So
Mm-hmm.
very slow walk, but a walk. And we were walking, and all of a sudden, this dog barks. And not a loud dog, not even close to us. I jumped so far
Mm-hmm.
and so far off the path that I bumped into my friend, and
Mm-hmm.
I think I screamed out loud and just, kind of grabbed my arms and myself, and then my heart was just racing. And I'm like, "Oh my gosh." And my friend looked at me, she's like, "Are you okay?" And I said,
Mm-hmm.
"Yeah, I I don't know what that was.
Mm-hmm.
I'm not afraid of dogs, right?
Mm-hmm.
Again, adult woman, not afraid of dogs. And I couldn't understand what had just happened. It was the
Mm-hmm.
strangest thing, and I was like, okay, that was different. That was weird. I said, I'm just on edge. I'm just on edge. It's okay. This
Mm-hmm.
is why we're walking, right? This is why we're walking. But walking did become a really big part of my healing. I enjoy walks. I think it's grounding. I think it's good to be in nature. Um, but I kept running into this same problem. So I started to avoid areas that I knew had dogs, that I knew might bark, but even a bird would be in my path. And I would immediately start thinking this bird is going to attack me. It's
Mm-hmm.
going to attack me. And then I'm going to be out here by myself. And then they're going to find this woman attacked by this bird.
Right.
And my brain would just start going into these spirals of re really ridiculous things that are not going to happen. But that's where my head was at.
Mm-hmm.
A grasshopper or a cricket would jump up and I would scream and I would run the other way. And
Mm-hmm.
I couldn't stand loud noises.
Right.
Anything loud or a sharp noise, I was having a lot of trouble with. And
Mm-hmm.
the place that I worked actually is a furniture commercial furniture company.
Mm-hmm.
And so they were always installing new furniture in our showroom and what have you. And oh, when they started with the drills and the hammer, I had to leave. I
Right.
had to leave. I couldn't take it. And it made no sense.
Mm-hmm.
It made
Right.
absolutely
This
no
is all new
sense.
to you. Like you've never
Mm-hmm.
experienced this before. Right.
Mm-hmm. Yeah. And so um this continued, I mean, for months and months and months. And it started to soften a little bit, but then even years later, I realized I was still having these reactions, these ridiculous reactions to loud noises.
Mm-hmm.
I was, creating these scenarios in my head where myself, my whole rest of my family dies for whatever
Mm-hmm.
reason, and it just did not make sense. And this was, you know, I knew I'd had some issues with anxiety in the past, right? Or, but nothing too crazy. And so
Mm.
finally I went to go see someone and talk to them through some of this stuff. And
A
it became
therapist.
a therapist,
Mm-hmm.
yes. And she just looked at me and she said, "Well, that's post-traumatic stress disorder."
Mm.
She said, "You're having these reactions to something that in your brain aren't a big deal, but your brain hasn't figured it out, right?" I wish I could explain it as well as they do, and maybe you could, right? I
Mm-hmm.
mean, but I think it made sense when she said it
Right.
and when she validated what was happening and the
Mm-hmm.
feelings and identified it and could call it something and give me tools to help n n not fix it necessarily, but the tools to help manage it,
Yeah.
right? And to keep managing my life and keep growing and keep building on the healing that I'd already done.
Mm-hmm.
But because I felt like I was stuck and I
For
didn't
sure.
know
Yeah.
why,
Yeah. Yeah.
you know?
Which is a feeling that comes with PTSD.
Yeah.
Yeah, for sure. So, like, and PTSD trauma can show up for anybody in multiple ways, but in particular, I assume that you're talking about, and your therapist helped you connect it to the trauma of the birth and the loss of your son.
Right. Mhm.
Yeah.
Because I think a lot of it had to do with, just understanding that, life can be taken so quickly, right? I
Mm-hmm.
mean, and you don't see it coming. And that's just the reality of it. And I I I knew that, right? We all know that, but until you, I think, experience it, and because it happens so quick,
Mm-hmm.
it's like my life was this certain way, and then within an hour, it was different.
Right.
And it will be different forever
Right.
because now I truly do look at my life. And I think a lot of other lost parents I've talked to feel this way, that you look at your life in before and after. It's
Mm-hmm.
before your child died and then after. There are two very clear parts, and that's just how we live now.
Mm-hmm.
And um, for a long time, I used to look at photos, and just say, "Oh yeah, I was pregnant with Henry then. Oh yeah, that was before Henry. Yep, that's a real smile."
Mm-hmm.
And the year following, "Oh yeah, that's the after Henry smile. That
Mm-hmm.
one's not real." You know?
Oh, yeah. Like you're just kind of showing up, forcing a smile for, yep.
I could see it, and I could
Mm-hmm.
see it. It was interesting because I also found something else I did after, we were with family and doing whatever, in that year following. When we take a family photo, when anyone would take a photo of me, I unfocused my eyes and pretended like I wasn't there.
Wow.
And
Yeah.
I'm like, I just have to pretend like I'm not here and this isn't happening. And I don't do that anymore. But it was an interesting response
Mm-hmm.
that just felt safer. I don't know.
Right. Yeah, for sure. Isn't that fascinating? I mean, in terms of the way trauma impacts people and PTSD works, is it's all, it might be strange and feel weird to you, but it's all in the effort to protect you from a bad thing happening again. You're like your brain is over perceiving all of these threats. And so like you're describing, even being in a room of people, even if you know them, doesn't matter. Like if that's where you're feeling, if that's what you're feeling, then that's what you're feeling, and your brain just does what it needs to do until it learns
Mhm.
that things are safe.
Right, until it learns. And because I remember my therapist saying, like, "Hey, you're safe right now. Right now you are safe." And I looked at her, I'm like, "I know. What do you mean? I know I'm safe." And she's like, "Your front brain knows you're safe, right?
Mm-hmm.
But the other part doesn't." The trauma, part is not back yet. It's not healed. And that made so much sense. And was really helpful, to because "You're safe. I know I'm safe. Like, what are you talking about?" And then that was always my response. I know the dog is not gonna get me, right?
Mm-hmm. That's not what
Logic,
it's about.
that's not about that. I still
Mm-hmm.
had this feeling completely course through my whole body. It
Mm-hmm.
felt like when these things would happen, I would feel almost an electric shock through my whole
Mm.
body. You know, when you get really
Mm-hmm.
scared,
Mm-hmm.
you know,
Yep.
and
Yep.
in that moment, like a car accident, or you think someone might hit you and you
Yep.
scream, and, you
Yep.
know, that feeling all the time, multiple times a
That's
day.
intense. That's
And so it
intense.
was just a lot. And I think I got to the point where I didn't want to be awake
Mm-hmm.
anymore. Because it was safer to sleep, um, because it was exhausting. I
Mm-hmm.
mean, I think my mind was so tired,
For
and
sure.
so I wanted to sleep a lot, and I wanted to just check out, you know,
Mm-hmm.
and not be present. Certainly not be present with my friends or a friend group. You know, I just
Yeah.
couldn't, you know, that just seemed hard.
Yeah, for sure. And you've alluded to it a couple of different times that things that were upsetting to you at that time aren't as much now. So it's clear that you've had some healing along the way, and within that, it sounds like you've found, well, I don't know how to say it. Within that, you've started to help other people. How do you know when you're okay enough to do that, and how did that come to you?
Oh gosh. I wonder that still.
Right, yeah, it's
Right?
a tricky and loaded question.
How do you know that you are doctor enough to help other people? You
Right,
know, like
exactly,
we can always learn more,
for
right? There's
sure.
always space to learn more and do things better. Um, but I was able to pinpoint, about 7, 8 months out, I was able to pinpoint a handful of things that were incredibly helpful that people did for me,
Mm,
right? And a handful of things that I wished I would have had that would have been really great, you know?
yeah,
And
yeah.
um, so I just sat there and I was like, gosh, what if I could make this better for someone else? Like,
Yeah.
what if there's something that we can do for these families? Because,
Mm-hmm.
you know, up until then, I didn't think this was happening at the rate that it is, right?
Right.
24,000 stillbirths in the US a year. You know, that's
Mm-hmm. Mm-hmm.
crazy. I had no idea. And so I just I thought there had to be more. And so I really just set out to create, you know, collections of items, that even just healing items that were useful to me.
Mm-hmm.
And is there a way that I can gift these to other families going through this after I do?
Mm-hmm.
It's a simple question, right?
Right,
And
yeah.
so I didn't feel like I had to be super far along or
Mm-hmm.
healed or
Mm-hmm.
in a good place mentally to be able to pull that together, right? It started truly as a craft project.
For sure. Well, yeah, like for some people, and yes, it was a loaded question, but for some people, the healing, that part, what you're describing of like doing for others and learning and is part of the healing. You don't
Hmm.
have to feel 100% better to help other people. No, yeah,
Right.
at all.
Yeah,
But it is can really help to know that you're helping someone else.
it did. That was a big part of my healing. I mean, and people, you know, will say, "Oh, that's so generous. That's so thoughtful of you." And sure, but it is selfish of me in a way because it's healing for me. It makes
Mm,
me feel better. It makes me feel like my son's proud of me, right? And it feels like I'm doing something good with something bad. And that helps, you know. That
yeah.
that helps, you know. Helps mama heart.
Oh yeah, yeah,
So, you know,
absolutely.
or you know, it's not unlike, you know, man, if your living child does something, you know, really frustrating or hard, you know, but then they come and give you the biggest hug and tell you you're the best mommy ever, and then you're like, "Oh, that filled me right back up. Look at that." You know, that filled my cup right back up. So
Hmm.
I feel like, you know, finding a way to help others, you know, in whatever capacity that is, it helps. It fills up that those dark spots, those holes, you know, even if it's just for a little while, you know.
Hmm.
Um,
Right, right, for sure. And I know, a lot of people describe the like post loss life feeling very lonely and
mhm.
isolating in many ways. So like what you're describing is of doing things for other people, I'm sure had a huge effect letting them know they're not alone.
It did. I mean, I think that was, and I even say I had great family and friends, right? But not everyone does, right?
Mm-hmm.
Not
Mm-hmm.
everyone is in a supportive situation. And even if you are, you can still feel isolated,
Yeah.
right?
Right.
That's just, that's the nature of it. That's the
Yeah.
nature of child loss, right? You're going to feel isolated because you're going to feel like you can't possibly connect with anyone else about how horrible you feel, right? How
Mm-hmm.
just devastated you are. Because no matter what story, what your story is, like what your loss is, whether it was, you lost your child at 39 weeks, like I did, or you lost your child at 12 weeks, or your child died from SIDS, right? Whatever it is, that thing is the worst thing that's happened to you, right?
Right. For
And
sure.
so, and so it makes sense that you feel like no one else can understand just how bad this is,
Mm-hmm.
except maybe another lost parent, right?
Mm-hmm.
And so I think it's so important to bring awareness to it so that people can find one another, right?
Yeah.
So these parents can start to find one another because once that happened, right, I start helping other parents, right? And connecting them with these gifts. A light went on, right? And it was like, oh, just like that time when my husband called me in the throes of a rough spot, right?
Mm-hmm.
A light came on again and helped me see that there's a way through this. And
Mm-hmm.
it's by connecting with others. It's by finding this community, right? And leaning on them and then branching out and making the community bigger because there's so many, right? There's so many.
Right. Yeah. Absolutely. So what happened for you from that point in terms of growing this community and the work that you started to do?
Yeah, so once I talk about building that community, um, once you start doing that, we're like looking at each other going, what else? I mean, should we get together? Should we do a
Mm-hmm.
thing? Should we get
Mm-hmm.
together and do a thing?
Mm-hmm.
You know, um, if I'm gonna be able to laugh again, right, it's gonna be with you, right?
Mm-hmm.
Because you're worried about everything from, is someone gonna judge me because I'm laughing? Am I like not sad enough? I mean,
Right. Right.
there's all these thoughts that go in your head. And so being able to have those conversations with those people who are like, yeah, how was that for you? What was funny?
Mm-hmm.
Do you remember?
Mm-hmm.
And it's like, yeah, we should get together. We should do some things. So we started doing events and things like hand lettering classes or watercoloring classes, floral workshops, things where we could keep our hands busy,
Mm-hmm.
right? But also organically find connection and support.
Mm-hmm.
So, I'm all for, any kind of support anyone needs, whether it's one-on-one counseling, whether it's group therapy, that's all great. However, I just find that the friends that we meet that are the greatest friends, we naturally have connected with in some
Mm-hmm.
way,
Yeah.
right? And so
Mm-hmm.
creating these organic experiences for these parents to keep their hands busy, do it in honor of their children, and do it alongside other parents who are feeling a lot like you are. And
Mm-hmm.
then also reminding them that, like, hey, you lost your child a year before I did, and you're still surviving.
Mm-hmm.
Maybe I could too, right?
Right.
And that keeps you going. And so we came into these, we started hosting these events, and then even a mother's retreat was formed. And so, it's like, what do we need? What do moms need? We need to get
Mm-hmm.
away. We
Yeah.
need to get away. We need to take care of ourselves. We need to
Mm-hmm.
honor our children,
Mm-hmm.
and just step back from our busy work and family lives that we're dealing with. And so retreats were a big part of that. And so everything just kept growing, just the need and then the support and then what we could offer, right? It was just a response to the need.
Mm-hmm.
And so it was really easy, to say, well, what would I like? What would be nice for me? What again do I wish would have already been in place when this happened to me
Right.
4 years ago, 3 years ago, wherever I'm at,
Mm-hmm. Mm-hmm.
and then how do we continue to support those folks now? How do I support someone who's me, who's 5 years out? In what ways do I still need support and what does it look like? It's
Right.
different. It's different. So,
Right. And to that point, there's a lot of I don't know if this was your experience, um, but what I've heard from a lot of people is that after a certain amount of time after the loss happens, like people start to trail off and then expect you to be fine, expect you to that everything's okay and that you've whatever. But they
mhm.
still, it's interesting. They like, there's still a lot of awkwardness around from
Oh
other
yeah.
people, around, do I say something? So it's much easier to assume that you're fine and that you're not affected a year later, 2 years later, 5 years later, or
Mhm.
whenever. It's
Mhm.
hard for people to grasp who haven't experienced it, uh, how what the grief feels like over time,
Right.
or
And
what it can
yeah,
feel like.
because yeah, and you never know when it's going to hit you, right?
Mm-hmm.
I mean,
Mm-hmm.
yeah. I mean, I was at a with my family at a some kind of old-timey town thing, right?
Mm-hmm.
And you're walking through and you're looking at the old barber shop and all this stuff. And I remember getting back to the car and just bursting into tears.
Mm-hmm.
And I'm like, what is this? Where is this coming
Mm-hmm.
from?
Mm-hmm.
And it was simply the thought that my family at that moment should have looked different.
Mm-hmm.
My family should have looked different. This experience should have been different. And it hit me. It just hit me really hard.
Mm-hmm.
And I wasn't necessarily ready for it.
Mm-hmm.
But I let myself cry. I let myself get upset, you know, and feel those feelings. And then since I allowed it, I was able to move through it and
Mm-hmm.
then go on with the rest of my day and just honoring that grief, honoring that moment,
Mm-hmm.
trying not to shove it down so I don't make anyone uncomfortable,
Right. Right.
you know, which I'm sure it did. But,
Well.
um, I've gotten really good about that. Just really comfortable making others uncomfortable. But
I'm all for it. Mm-hmm.
right? But I think when you can actually explain your your thoughts and your feelings on it, and say, "I'm sad." That doesn't mean you have to be sad right now. I'm just
Mm-hmm.
really sad because I just pictured my life differently. I'm
Mm-hmm.
having a hard time with it in this moment. I'll be fine in like
Mm-hmm.
a little bit, but just like be gentle with me if you
Mm-hmm.
don't mind,
Right. Yeah.
And it's as simple as that, right? And that can be hard to say, but if you practice it,
Right.
maybe you will be able to because we do as a society, even before I lost my child, I would say I was not super comfortable with the idea of child loss, with the idea of anything uncomfortable with death, grief,
Mm-hmm.
loss, any of
Mm-hmm.
it. Hard pass. No,
Right.
thank you,
Right. Right.
And now I'm like, oh, here, I'll talk about it all day, you
Exactly.
know?
Right. Yeah.
So I think the more exposure we get to it, the more
Mm-hmm.
we like just in general, even folks who, if you haven't experienced a loss, you can be just a phenomenally better human by just honoring anyone's struggles, right? Honoring
Right.
whatever it is they're going through. Maybe they lost their father or their mother or a grandparent or a sister or whatever it is, right? Honoring that grief that they're holding and holding space for that, I think
Mm-hmm.
is so valuable and we could
It
come
is.
such a long way as a society if we do that.
Yeah. Absolutely. So, in the work that you're doing now, the way that you're supporting people, I mean, you've created a whole thing, a whole platform, a whole way to
Yeah.
support. So, tell us a little bit about that.
Yeah, so Haven is a nonprofit, and we have been shipping out healing gifts since the end of 2017. So those are the gifts I mentioned that
Mm-hmm.
we send out, and we have a form on our website. And parents, if they are experiencing loss, they're welcome to fill out that form and request one for themselves. We always encourage family members or friends to reach out on behalf of others for them because
Mm-hmm.
sometimes they just don't have the strength to do it themselves. So
Mm-hmm.
we ship those out actually to every state. We've shipped them to Canada at this point as well. And I think the first year we shipped out like 18 of them.
Mm-hmm.
We should do likely over 200 this year.
Nice.
And that number has essentially doubled every year since we've started and since people have become aware of the organization. We do hold an annual remembrance event in October. This year it's actually going to coincide with Pregnancy and Infant Loss Remembrance Day, which is October 15th. So we always hold a special event for moms and dads that day where we participate in the Wave of Light. It's the International Wave of Light.
Mm-hmm.
Maybe we can link that as well.
Mm-hmm.
Um, and then most recently, we have launched a podcast platform called Landscape of Loss. So on this podcast, I am actually the host,
Mm-hmm.
and we are simply um, sharing stories of loss and sharing perspectives about surviving grief. So we're talking to parents who are willing to share their child's stories, not unlike what I just did, and trying to get that information out there so that they feel validated and, reminds them and everyone that they love that their child existed, right? Because as parents, we want to talk about our kids, whether or not
Right.
they're alive or not, right? We love talking about our kids. They're awesome, right? But even if they're not here, I still love my son so much. And I think
Right.
he's beautiful and he's wonderful and a light, a true light in my life, right? And I want to share that with folks.
Mm-hmm.
And so we're sharing those stories. Parents are coming on and sharing those stories. And then what we're also doing is we're bringing in providers, we're bringing in professionals in the field, and we're getting stories from them about how loss impacts them, about tips and perspectives on grief, right? Talking to counselors, funeral directors, physicians, nurses, bereavement photographers. I mean, there's so many people, right, that are impacted by loss. And so we can create just this intersection of information
Mm-hmm.
and have it be essentially, I'm going to use the word selfishly again, um, a resource that I wished I would have had, right? If I could have
Sure.
looked at and said, oh my gosh, look, there's a podcast episode about lactation after loss. Like,
Mm-hmm.
oh, I didn't have any of that information. That would have been
Mm-hmm.
amazing.
Right.
And so we're putting that resource out there. Again, podcasts are great. They're free to listen. You can listen to them anywhere. You can scroll through and see what episode makes sense for you or you connect with. And so we've been doing that since April. We have 13 live episodes, and
Great.
I'm very proud of them.
Yeah, I'm so glad to hear that you're doing that, and you should be proud. It's a necessary. Um, it like there's so much power in the storytelling that comes out for the person telling the story, but for those who are listening who can connect on some level. It might not be every single aspect, but
Right. Yeah.
certainly might be able to connect to parts of it and get the resources and get the information. Because that, I mean, right, the more you learn, I don't know if this was your experience, but for a lot of people, anyways, the more you learn about it, the less blame you put on yourself for
Mm-hmm.
guilt or shame or whatever it is.
Mm-hmm.
Um, so yeah, we all need that.
We do. And I
Yeah.
mean, I'll tell other parents, they'll say, oh, I just feel guilty. I'm like, it's not your fault. This is
Right.
absolutely not your fault.
Right.
But I need to be able to tell myself that too. And the
Mm-hmm.
more practice I get telling other people it's not their fault, the more practice that is telling myself, right?
Mm-hmm. Mm-hmm.
So,
That's fantastic.
um, I can look at, my grief experience and my mourning experience now from an outside lens, right? And look back on it and just, see not necessarily what pitfalls or missteps, but just spots, right? Spots that were really difficult and spots that maybe I could have used a little bit of guidance through.
Mm-hmm.
You're in the throes, right? In that dark, difficult time. Maybe it's in that first year, right? And just simple things like going to Target sound
Mm-hmm.
real hard, right? And
Mm-hmm.
so there's two schools of thought on that, right? One is, yeah, just go rip that band-aid off. You need to go do the things and you'll feel better once you get it done and they get the first one out of the way. The other school of thought is, hey, you know what? We have like order delivery now
Mm-hmm. Right.
everywhere. Why
Yeah.
don't you just order it and just save yourself from that? Now, both things are true in a certain capacity, right?
Mm-hmm.
Because it is a step that you are going to have to overcome. at some point.
Mm-hmm.
Now, if you are not feeling like you are up to that right now, maybe you should just order your groceries online or
Right,
whatever it
right.
is,
Yeah,
right?
yeah.
And save yourself from seeing the inevitable mom with babies in the cart, you know, other crying children, pregnant women, things that are going to be triggering, right? Those are the things it's going to be problematic.
Mm-hmm.
And so I just don't think you should try to be a hero. I think you should keep yourself in mind and make sure that you are being kind to you right now
Mm-hmm.
because
Mm-hmm.
you need to heal you. Otherwise, you are not going to be able to be there for anyone, whether it's the rest of your family, whether it's future children, whether it's friends. You need to focus on you and feel okay about feeling a little selfish and take that time.
Mm-hmm.
Um, I think there were even moments when I felt like I wanted to get back into shape for some reason
Mm-hmm.
post C-section. Like what is that proving? Who am I kidding?
Right,
And so
right.
and I don't know why, that was something that I was pushing onto myself, right? There
Right.
wasn't a certain person pushing that on me. That was a me on me thing. And so watch out for those, right? Watch out for you being your own worst critic
Mm-hmm.
because right, she can be kind of a jerk.
She sure can.
Right? I mean, talk to yourself the way you would talk to your friend. And I think if you can do that every day and remind yourself, I'm going to talk to you, myself, just like I would talk to my best friend or my sister or someone else you care and love about, right?
Right.
Yeah. So be kind to yourself. Be kind to yourself because I'm not saying no one else will be, but you need to be your number one support and your
Mm-hmm.
number one advocate needs to be you. It
Mm-hmm.
really does. If you can muster together any type of strength, do that for yourself because you will not be sorry. You will not be sorry that you did it. And take that time. Take the time you need. Sit down with a photo of your child or a thing that reminds you of them. Go to the dark place. It's okay. You can set grief appointments,
Mm-hmm.
right? You can set those appointments and say, you know what? Today, this afternoon, I'm going to sit down. I'm going to rock in this rocking chair. I'm going to hold this blanket. I'm going to look at the crib. I'm going to look at photos. I'm going to do whatever it is, whatever feels good. Listen to that song. Do those things. Set that appointment because you have it then. You have it to
Mm-hmm.
go back to. It's like a safety net, right?
Mm-hmm.
And so you can
Mm-hmm.
go and you can do that. And then once that's done, you say, okay, I'm going to take a deep breath and I'm going to leave this space, right? And then I know that I can visit it again when I
Mm-hmm.
need to. And
Mm-hmm.
and whether that's in an hour,
Mm-hmm.
in those early days, it might be in 1 hour, but it might be in a week, right? Or in a month,
Mm-hmm.
depending on where you're at. And so taking those taking those liberties, right, for yourself, I think are so important. And then, something I did is I did put a screensaver on my phone, which I was scrolling through old photos the other day and I found, and I am gonna do a terrible job at saying what this quote was,
Mm-hmm.
but it was so great because it basically just said, uh, you today you don't feel great, but keep going because eventually, if you keep going, there will be a day that feels better. You will feel better than this.
Mm-hmm.
And every time I looked at my phone, my screensaver, I was reminded, you will feel better than this. You will. You will. And
Right. I'm so glad you're bringing that in, and speaking to it too, because that that like the intensity of grief feels like you'll never feel better again. And
mhm,
it's really hard for that those big feeling to have the big feelings, and like you were saying, that front part of your brain to be like, okay, you'll be fine, because it's all encompassing. That
mhm.
it just feels like the new truth.
Yeah, it takes
Uh,
over,
right.
right? It takes over. And so, yeah, if you can try to start taking back some control, take back little bits at a time, take that control back. It doesn't mean you're forgetting. It does not mean you're forgetting your child.
Right.
Not at all. But,
Right.
you need to take care of you or you
Mm-hmm.
can't take care of anything,
Mm-hmm.
right? And you certainly can't, I call it parenting my child that's in heaven, right? But I can't do that if I'm not functioning.
Mm-hmm.
And
Mm-hmm.
so it's something to think about. But I will say also, if you have a a friend, a sister, a partner, that is going through these motions, keep an eye on them, making sure, right? Postpartum depression is real, right? And especially when you toss grief in the mix, and
Yes.
keeping an eye on changes in behavior. If they stop talking, really are not willing to open up, know when to get additional and professional support,
Yeah.
and encourage that, because we can't say that enough, right?
Yeah,
I
for
mean,
sure.
yeah, we need to encourage mental health, professional support, throughout all of motherhood, right? And for
Absolutely.
anyone.
Right. Right.
So I'm definitely the first one to, sign up for that. And I will say a lot of the insights and tools that I've been able to gather and then pass on are things I learned through counseling, right?
Mm-hmm.
Things that have helped me. And
Mm-hmm.
I just want to be able to pass on the things that help me to other people.
Right. Right. Thank you. And thank you for doing that and sharing your story and creating the platform and giving that love out to lost parents.
Well, thank you. Thank you for also sharing our stories and our platform, and taking time and space to honor, the children who didn't make it on, through October. So
Yeah.
I think that's so important, especially when we're talking about, you know, mom blogs out there, right? There's lots of stuff out there, but it can feel like, for lost parents, it can feel like your kids get forgotten and your situation gets forgotten. So
Mm,
it means a lot when people honor and hold space for us.
great. I'm glad to do that. And I'm glad you're now doing that for other parents as well.
Well, thank you. Mutual thanks here.
If you'd like to get connected with Jen, please check out havenmidwest.org. You can also find her on Instagram and Facebook at Haven Midwest. And her podcast, Landscape of Loss, is available on all podcast platforms. As usual, if you know of somebody who could benefit from this resource or benefit from hearing this episode, please do share it with them. The more we can talk about this, the more we can reduce the stigma, the less lonely people will feel in their journey. Thank you so much for being with us. Until next time.